Great to see you. My name is Dharmendra Kanani. I'm Chief Operating Officer and Chief Spokesperson at Friends of Europe, and I have the pleasure of moderating this summit. And I hope that you will all stay the distance in this ridiculously hot weather that we're experiencing. I know we love it. We absolutely love it, obviously, but hey, what better a day to be discussing the implications of all that and health in terms of what's happening to our future right before our eyes, actually. I've got a great pleasure. I've got a wonderful panel of contributors who are going to be discussing the issue of sustainable livelihoods, but also in the context of how do we reframe healthcare for the future? Is competitiveness, innovation, and making sure we're sustainable contradictory, or are they actually self-reinforcing? Given where we find ourselves at the moment right now, on the eve of a new mandate, what's it going to look like? Well, other gains that we've made so far, some will say not many, but others will say a lot, that since COVID, we've achieved quite an interesting infrastructure for healthcare. When you think about the different elements that have been put into place, especially now with the notion of a European Health Union, you've got the data space, you've got HERA, you've got a range of other kind of bits and pieces, institutional architecture that might lead us to the pathway towards a union and a competence on health. Yet, the EPSCO Council discussion that happened only last week, they made very scant attention or detail regarding a health union. People were speaking more about competitiveness and security. Politicians obviously will be speaking to the kind of the echo chamber of what they've been witnessing in the elections, but also this sense of panic that we need to withdraw from our long-held traditions or commitments to making sure we do the right thing for the people on the ground and make sure that fairness, equality, and social justice matter. Yet, the elections are what they were, but I just hope that we don't see a shift and a working backwards and an undoing of the good that we've witnessed so far in the past, at least in the past 5 years, and in the past 20 decades or more, because we've made a lot of social progress. But let's hope that we don't end up having the kinds of economic divisions, the lack of social mobility, and the kind of entrenchment of ideologies that are likely to affect how we think about, experience, and understand health in Europe. So it gives me great pleasure that we've got this interesting panel of folk. We have a minister online who was unfortunately couldn't be here with us, but very pleased to welcome you. Thank you, yes, waving away. Thank you very much for that. I wanted to start with you, actually, Jakub, that you're at the council, you've seen what took place. What are your views on, and what's your reflection on where we find ourselves right now? Share with us that your sense of, you had that conversation, you've part of these conversations for some time, but are you kind of feeling a sense of optimism still? Are we moving? Do you feel we're going to still move in the right direction, Jakub?
No, I believe we move in the right direction. And hello to Brussels. It's great to see you, all of you. But to be honest, I mean, if I could somehow express the feelings, or let's say the atmosphere, that at the council it's mainly about the political topics, and all of us who are sitting there are somehow politicians. And what I feel is now the message, or let's say the topic which resonates, it's, let's say, much basic need of access to basic medicines. Unfortunately, yes, of course, the pharma package and the development on the market exclusivity and all that protection was, of course, the topic. But then you see, that majority of the member states are really dealing with the issues of supplies of very basic medicines. So yes, of course, the sense for innovation is there. We know that we have to really, move it forward. But on the other hand, we see, that we have problems, with the basic care. Doesn't matter if it is the treatment itself, I mean, the pharmaceuticals, or the AEs or the nurses. So we are really talking about the sustainability of the system. So yes, I know, that the topic of today's conference is the innovation. But you asked me, what was the sense and feeling, on the council, and unfortunately, or maybe not, it's more about, how we can sustain the system itself, and of course, how the innovation could fly. But yeah, the topic and the feelings are like this.
And in terms of your sense of whether innovation, I mean, given that innovation is going to be absolutely essential to move us forward in healthcare, especially when we think about the role digitalization has played, how it can create economies of scale, how it can make healthcare even more efficient and faster, cheaper and better. Do you think that agenda will still stay alive as we move forward?
No, absolutely. And I believe, it will be the topic of the Hungarian presidency. You probably know that there was the question, from the Belgian presidency. There was 4 scenarios, and for majority or for a number of member states, it was very difficult to find, the one of those possible scenarios as the one they want to push forward. And it was very difficult, to find the joint opinion on those 4 different scenarios. So yes, we will definitely focus on that. We will try to move it forward as fast as possible. But unfortunately, till now, there is no, let's say, joint view on how we should move forward.
Okay, which is a disappointment given all the lessons we've learned from COVID, that it was probably the biggest example of collaborative practice and the ability in adversity to do the things which we thought were unimaginable. And actually, yet here we are, less than 4 years later, we seem to have lost the lessons of that. But Jakub, I'll come back to you in a moment or two. Let's turn our gaze to the Commission. Natalie, good to see you. I'm glad you could make it. Tell us a little bit about, from your point of view, given where we find ourselves, what's the outlook on living longer and better in the context that we find ourselves, given that that's going to have an economic cost too?
Well, thank you very much. And I think in order to respond to your question, I'll turn to the citizen, because I would like to refer to the latest Eurobarometer poll that was launched before the elections, before the European elections, and it indicated that the European citizens place the fight against poverty and social exclusion, 33%, as well as supporting public health by 32% as the 2 main issues on the top of their mind. The question is whether we can look at the issue of the future of the health system in a silo approach, or whether we shouldn't look in an integrated manner. And I would be more going into the second type of thought. We need to think to ensure more equality in access and sustainability for EU citizens in the face of demographic trends, potential future crisis, I mean current crisis, ongoing crisis. To face all this, we need greater integration. Without a coordinated approach to health, we really stand to lose the valuable insights which were gained from the experience of the pandemic. So in May, the Commission published a communication on the European Health Union acting together for Europe's health, which showed 3 very important priorities. We need to have a new health crisis framework. We need to have the security of the medical supply. And this raises a number of issues, including the issue of the resilience of the availability of the critical material, the critical components, etc. And third, we need to have modern and innovative health policies. How do we get there?
Indeed, those are fine words, but given where we find ourselves, I'm really interested to see what you're going to see next. Go on, go for it.
So how do we get there? We have one part of the work, which is to progress in creating an integrated, as much as can be, regulatory framework. But we also work in the Commission and in my Directorate General in DG Reform to enhance the Member States' capacity to integrate innovation and to strengthen the health systems. For this, we use our technical support instrument, which is a program of the Commission that allows us to support Member States' reforms from the stage of inception of a reform to the stage of implementation of a reform at all levels of governance, Member State, local, regional, etc. And we work in a wide range of areas. We cover a very wide range of topics, including strengthening primary health care, hospital sectors reforms, e-health, interoperability, which is absolutely key, workforce, integrated care, mental health, cancer screening and care, health technology assessment, and pharmaceutical policy. We have made over the last year remarkable advancements in health technology, but we need to make sure that we empower the patients with more information and more control of their health and the health information. With the rapid technological advancements come the responsibility to ensure that these innovations are both safe and effective. And this is where health technology assessment becomes indispensable. This is a multidisciplinary process that systematically examines the social, economic, organizational, and ethical issues of a health intervention or health technology. By assessing the economic implications of these new technologies, we, with the HTA, will help to allocate healthcare resources more efficiently, ensuring that investments in new technologies provide the greatest benefit to patients and to the healthcare systems. And this is particularly important as it involves the assessment of the quality of life and of patient satisfaction. And it ensures that the technologies not only extend the life, but also enhance the quality of life. So there, again, I plead for an integrated, cross-sectoral, multidisciplinary approach. And while the development and the assessment of health innovations are crucial, it is equally important to ensure that patients have access to these advancements. So innovation should not be a privilege only, but a standard of care that is accessible to all. For this, we need to address several key areas. The regulatory framework, as I already mentioned. We have the new HTA regulation, which will apply as of next year, and that establishes a more harmonized framework. We need the affordability and reimbursement of care, which requires collaborative efforts between the governments, the private sector, the insurance companies, to develop sustainable pricing and reimbursement models. And third, we need education and training. So healthcare professionals must be adequately trained to use new technologies. And this is essential, notably regarding all the digital development, to be able to make better use of the advancement of the digital technology and better use of artificial intelligence. And for this, we provide technical support for strengthening the national frameworks in view of the implementation of the Health Technology Assessment Regulation. We have been working with Greece, France, Italy, Spain, Luxembourg, Malta, and Slovenia to build the capacity in the member states to lead to a successful implementation of the regulation, because this will ultimately enable faster and more equitable access to new health technologies, to medicinal products, medicinal devices, digital therapeutics, biomarkers, diagnosis, and to better access to health innovations for the population at large.
Natalie, thank you very much for that. And I hear you in terms of the things that you're doing. But, you know, the questions that everyone has in their mind is, how politically proof is what you're saying that it's possible? And secondly, it would be interesting to understand from you, the countries you've worked in, okay, what kind of assessment did you get of their aptitude and capability, or are you not prepared to say?
Okay. It's a very interesting question. Let's say that if they come to us for support, it means that they consider
It's
that
important.
support is needed and support is important, and support will be in the interest of the further development
Sure.
and innovation in the
Okay, sorry, I
health
put you in
system.
a hole there. I didn't mean to. Let's put it this another way. How collaborative were they? You can say that.
Yes, that I can definitely say, that the member states we're working with in all areas, in all related areas, are always very cooperative. Maybe I should have specified from the start that we only intervene upon request from the member states. So it's never anything that is imposed on the member states, but it is the member states that come to us. In some cases, we do propose projects that we base on the needs assessed in the member states, so on the feedback from the member states on what exactly their needs are, and in order to help the member states to fulfill or achieve priorities agreed at European level. So for 2025, for example, we're going to propose a flagship, that is a pre-prepared project, to establish a health hub. If you look at the conclusions of last Friday's EBSCO, you will see that the Council has invited the Commission to work to establish a health hub, taking into account the results of a pilot project driven with the support of the technical support instrument, which was a project to help to facilitate better health spending, better quality of health spending, and better access to health spending, notably through a hub that is going to facilitate access to the different programs that exist in the European Union that are accessible for health. EU for Health, Horizon Europe, TSI, the RRPs, etc., etc.
And when you think about what Jakob was saying, one of the takeaways was, it's almost like we're going back to basics in terms of access to good, easy, cheap medicines and the kind of lack of effective supply of that. How is that factoring in your kind of reform agenda, given what we learned from COVID? And all that you're saying is absolutely excellent in terms of and from Friends of Europe's point of view, we think multidisciplinary, multisectoral is the way to go, absolutely. But how do you square that circle of access to the basic thing, which is medicine?
Yes, and this was actually my first point, which is the issue of the resilience. When you're talking about access to medicine, you're talking about the resilience of our European industry and the capacity of our European industry in times of crisis to have access to the essential components. So for this, we're also working, and we're going to do a lot of work in the year to come with the member states to facilitate internal processes, to establish, for example, early warning mechanisms in case of a crisis in the making, to establish quicker public procurement mechanisms, to have quicker, faster access to the essential materials, and to work together to establish systems of cooperation and coordination in order to facilitate access to medicine, not only at individual member states level, but for everyone in the European Union. And I think this is really the positive take that we can see from the action of the Commission at large during the pandemic, with the access to the masks and then the access to the vaccines, and the vaccines for everyone inside, within the European Union, and also out of the European Union for developing countries.
Okay, thank you. I'm going to stop pummeling you with questions, don't worry. But we'll have a Q&A, and I'm sure lots of people will have things to ask you. But I do believe that, one of it is odd and strange that human nature is such that adversity is the only thing makes us work differently. And it's, when you talk about data, we know that the member states are, viciously protective of the data, and the ability to create even a data set that's shareable across the EU. We're not nowhere there, but power to your elbow for doing the right thing anyway. But and the health hub idea obviously is a really important thing, and let's hope we give that to life. But on that point of industry, Monica, you are our only industry person, if you like, on the panel, and it's great to have you back. And I think she's the only doctor on the panel, by the way, so it's good. We've got someone who can, if something happens, we know that she'll take up your pulse and check your blood pressure. No, we love Monica. But having been a practitioner, but now she's in this really senior position in this company. Share with us, Monica, your sense of where innovation stands at the moment, where you think what we should be looking at. What's your vision for innovation and what's possible? Which is a really big question, I know, but I think you'll be able to roam around that really well, given you've been a practitioner.
Looking forward to it. So it's a fascinating time for us because on one side, I have a lot of hope. I think science has never been more exciting than it is now. And as you say, I started off life as a doctor. I still remember the first psoriasis patient I treated with a biologic. And when she came back and told me that she'd taken her 4-year-old son to the swimming pool for the first time, there was a tear in all of our eyes. Now, that woman probably shouldn't have got that treatment based on the NICE criteria. I had a consultant that, shifted a few things and got her onto that treatment. But access was and still is today one of our major issues. And when we see the advances that have happened in healthcare, take metastatic melanoma. If you were a patient 20 years ago, that is a death sentence. Now you have a 1 in 2 chance of survival. Innovation has progressed at amazing speed. And now we need to make sure that we have the infrastructure to support this. And what I find interesting is actually the healthcare spend on medicines has been pretty stable over the last 20 years, despite this acceleration of innovation. And when it comes to us looking at innovation now, the question shouldn't be, can we afford it? It's, can we afford not to? Because Europe now is in competition globally in terms of innovation. And we can see in areas and regions where people have prioritized innovation. In Japan, for example, they extended their RDP by 2 years. Clinical trials doubled in that space. So we see the benefits of having a virtuous ecosystem where you're prepared to invest in innovation is a positive benefit. If you invest $1 in public healthcare, you can expect $14 in return. So this is an area where we really need to work in partnership to have an ecosystem that sustains health for our population and keeps Europe competitive in a global system that is potentially accelerating at a faster rate than us.
I think you kind of set the frame for this conversation. $1 gives you $14 return. And I don't think we often think about the economics of what we do, especially the economics of prevention. One of the things that we never get right is to think about if we were to be able to prevent non-communicable diseases, my goodness, the cost saving would be huge. In terms of the kind of innovations you're engaged in as a company, just give us a sense of what's your pathway ahead on innovation.
So I joined BMS about 10 months ago. My past, since I joined the industry, has been about launching new medicines. I've launched 15 medicines in my career, so pretty much one a year. And the reason that I joined BMS is the pipeline. I'm a scientist at heart, but I'm a scientist that believes in bringing new treatment options to patients. So the spaces that we are involved in are really critical spaces like oncology, like hematology, like cardiovascular, and in the future things like Alzheimer's, which I think as we all get that little bit older is a really pressing topic for us all. And the industry now has the opportunity to invest in some really exciting opportunities. There's new modalities like cell and gene therapy, like protein degradation. This is a truly exciting time for science in some really critical diseases. And we really are passionate about having strong partnerships at a parliamentary level, at a market level, because we know still today at an access point happens at a market level. And we need to try and work together to make sure that we're able to provide this innovation to patients.
What are you looking for from the next mandate?
Open and transparent discussion. At the end of the day, I firmly believe that we have the same common goal, which is firstly to provide universal access to patients. Secondly, to provide an ecosystem in Europe that allows us to flourish, that allows us to invest in clinical studies and build that ecosystem that brings that innovation to patients. And when you share a common goal, I have to believe that if you come together at a table, you can talk about innovative solutions. How can we really have this strong partnership that delivers results? But we have to do this from a foundation of supporting innovation, believing that this is not a cost, but this is an investment for us in Europe.
Indeed. I mean, in the letter report, and you know what we know from the sneak peek of the Draghi report, the sense that both of them are saying that healthcare will flourish if we get the single market absolutely correct, and the fact that at the moment it's not. I'm not going to ask you about that, but I'm just, as a segue into this conversation, that both of these big guys are talking about unfinished business of what the European project was about, namely the single market, but also the fact that in letter he's saying that as we get older, we are not even planning for the social care needs that we need to have in the next 10 to 20 years, basically. So there we go. That's kind of the issues that we have. It's over to you. What questions or issues would you like to raise? Any concerns, any questions, either of any of the panelists or just of each other? Because you're here to not only to be passengers, but hopefully interact in the discussion with all of us. Excellent, sir. Thank you. Please, we have a mic on its way. Please to say who you are.
Okay, so I'm a technologist, not a medical doctor, unfortunately. But as a technologist, I have quite some experience in road mapping.
Your name, please.
Sorry, Fokko Wieringa from the Netherlands. I work for IMEC. IMEC is what they call the watering hole of the semiconductor, the chip industry. Everybody comes together there, and pre-competitive new technologies are being developed. Now, to achieve that, we have been doing road mapping. So your phone, your computer, your tablet is so small and so affordable because all these decades, chips have been shrinking, prices have been shrinking, performance has gone up. And that only was doable because all the firms that were doing this, first they competed straightforward with each other. But then they realized to make the next node, to make the next step in miniaturization, the cost would be so high, the investment would be so high, none of the big players could do it all themselves with the investment. So they realized they should invest jointly. It's like 15 publishers that all have different markets for writing books or magazines, but they want a better printing press. So they jointly invest in this new printing press that they can all use to make their own books. Bad example maybe. But road mapping is essential. We've learned that. And the semiconductor industry has proven it flourishes. And there's competition there, but there's also co-opetition. So we've proven that this road mapping works. And I was wondering, what is the European Union doing in, say, medical technology, medical pharmaceutical road mapping?
Okay.
And one thing I have to add, yesterday we discussed this, the shortage of healthcare workers is a big worry.
Yeah.
And any roadmap that wants to make disruptive improvements needs to take into account workforce. Workforce should always be a part of that.
Road mapping and workforce. It's okay. Eva, let's take the phone. And it's not the phone, the mic, sorry. And I'll come to you as well. Great. Introduce yourself.
All right, Eva Rennen. I'm the founder of Gnostics, medical diagnostics company focused on infectious diseases. And Monica, like you said, a lot of disease areas are actually seeing a positive trend in terms of innovation is really causing a positive effect on whether people can be treated or not. But infectious disease is actually showing a completely opposite trend. So where we were able to actually cure infectious diseases quite easily, we're seeing that it's getting out of control and it's becoming harder to treat. And if you look at, for example, antibiotics development, so I'm also part of Beam Alliance, SMEs in antibiotic development and diagnostics, we see that actually, if we look at innovation for social good, antibiotics are critical. But the business model is very challenging. Because when a new antibiotic is developed, it needs to be taken off the market. So I'm wondering if the panel has any ideas on how we should come together as a European Union to solve this problem.
Okay, great. Lady there with the blue. No, I was actually... No. This is great.
Thank you very much, Francesca Ligi, for the Red Cross. Actually, I have a question because the International Federation of Red Cross and Recreation Society World Disaster Report published after COVID showed that we are missing, in that pandemic, a very important piece was missed is trust. The trust from the patients or who should have access to the public health system, the trust that we have to build, the trust that we have lost, and we have to rebuild in health institutions, especially in case of public health emergencies. So it's good to talk about innovation, efficiency, but if we don't have the trust from the people that needs health care, we are not going so far.
So what would you like to see happen then? How, from your perspective, what are the things that people like a minister like Jakub or the politicians we've got here on the panel, what could they do, in your eyes, to help rebuild that trust or even build that trust?
I think that an important step is to involve the workforce, as we said, to be more close to the people, but also health literacy. It's super important to give the instrument, the tools to the people to understand what is happening and what they can do with the support of the public health institutions.
Excellent, thank you. Just here, lady. Just here.
Hi, I'm Julia. I represent Care for Everybody, which is an NGO that aims at raising awareness on gender discrimination in healthcare. And, well, besides the ethical and human rights implications that gender discrimination that still exists to a very great extent in healthcare here in the EU and at a global level as well, there's something that it's causing a huge impact in our societies, and that's the major economic loss that is associated with the loss of productivity of women not getting adequate healthcare. And it's been discussed more and more, the need for a new strategy on women's health, and I would like to know what's your point of view in it, how would you address it, and if you could comment on how the EU plans and also the private sector to address gender discrimination and to close the gender health gap, because after all, everyone ultimately benefits from it.
Indeed.
Thank you.
What would you like, again, just what kind of small things that you'd like to see happen? Because I think, you know, what we do know that is healthcare and science is not gender blind. I mean, those of you who have experienced or know about endometriosis, 25 years ago, a woman would go, be misdiagnosed, be put on all sorts of nonsense. And only in the past 10 years, women or young people can be actually confident that they are being diagnosed properly on something like endometriosis, which is such a sufferance for women across the board. But it wasn't a priority, unfortunately. And so, you know, we are where we are. But I'll come to you in a second. But what would you like to see happen?
For example, I was in a very interesting session before on data. More representation, equal representation of men and women in data research, in clinical trials as well. Not just that, also disaggregating data for the period of life that women are, because menopause, premenopause, fertility, puberty are quite different, and the body of a woman is different. So that's one thing, but as well, more innovation, more training on gender equality for healthcare professionals.
And what we, BMS and others have said before, actually, is that we have to make sure that it's not just about white women, because we know it has to be diverse completely. African women, Indian women, other very different, you know, sets of data. And you know, I remember during the COVID period time that, you know, the thing that measured your pulse, or no, your yes, that actually didn't work on certain skins, but it was giving false readings, and people hadn't thought about it because there wasn't diversity in the clinical trials, which is crazy. Thank you very much.
Thank you very much for pointing it out.
Not at all. There are so many of you. I feel as if this is why we do this. So if you don't mind, I'm going to carry on with this because it's important, just for literally 5 minutes. Lady there, and then I'll come to you, and gentleman there. But be brief, please. Otherwise, I'll eat up lots of time that I don't have.
Yeah. Sorry. I'm Gabriella Bruzzo from Healthcare.Harm Europe. Actually, I have a question for Nathalie. I really like that when in your speech you talk about cooperation and resilience. So I wanted to know if in your work with and in collaboration with the member states, you also talk about climate resilience, and is it a topic that it was brought up? So obviously climate change is affecting the health of people, so is a burden on the healthcare sector, but at the same time is actually affecting also the healthcare infrastructures. So sometimes they are not even able to provide the healthcare service. And as climate change is a global issue, cooperation is obviously needed. So I wanted to know if this topic of climate resilience was also in the conversation.
Okay, great. I can't any more. Did you just I have to be like 60 seconds.
Very short, actually, my question.
Do introduce yourself, please.
Milena Richter from Sanofi. I was wondering if there's scope for joint meetings between ECFIN and EBSCO on health investment.
What a brick! You knew that's a political question. Absolutely, excellent. Very good point, though. It's absolutely necessary. So there's a bunch of stuff there that we should look at. If I could just, Jakub, can I ask you to just address? I know you're thinking you're probably going to take it easy. You're online, but no. That question of trust, Jakub, you are a politician, and that is the kind of hoary chestnut for every politician. Is about how do I make sure that people trust what I say, what I do, and the question on the health issue is raised quite loudly. Say a little bit about that, or and respond to some of the points you've heard as you wish. Over to you.
Oh, thank you. I believe that majority of what was said was about the transparency. And if we take, for example, where we are, for example, in the information provided to patient, what we can provide it, on daily basis, and how, for example, the system already moved, forward. So you can easily now find everything on the internet, on the web pages which are based in the US, but in the Europe, we're still protecting the patients, to get the direct information about, for example, about the clinical trials, about the new medicines. We have to really think, how to move the patient, from somebody listening to somebody who is really trained and educated to also make their own decisions. Yeah. So from my perspective, it's really about building the more access of information to the patient, to the patient organizations, to really help them to be, let's say, much stronger partner in the discussion with medical professionals, with the healthcare providers. And I believe the number of things which I mentioned here, if we will help the patients to be more, let's say, matured, in the dialogue and conversation, it will help a lot, in majority of what was said here. And then, of course, the data transparency between us, the regulators, state administration, and the pharmaceutical industry. Yeah, because we see faster and faster, let's say, access at the beginning. If you take EMA, for example, the last year, there was 39 new active substances, and at least 3 of them through accelerated assessment, 8 conditional marketing authorization, and 1 approved under the exceptional circumstances. So you see there is a more and more at the beginning, of the uncertainty. Again, if you will not be able to balance this uncertainty, we will have a number of problems, to provide this kind of treatment to the patient. So if we are speeding up at the beginning, we have to also find the balance, in the risks which are then taken, by the system themselves.
Okay, great. Thank you very much. Before I move to other panels, Natalie, obviously there's the pathway issue. In terms of when you're looking ahead, you need to make sure that there is something that you're looking ahead, and that the workforce is also needs to be part of that. And also, you might want to take that question about if it's possible to have, ECFIN and EBSCO meeting together at some point, which I think, you could have answered that question too, Jakub, but we'll come back to you later. Go on, over to you, Natalie.
Thank you. Thank you very much. The question of the workforce is key. And I really believe that member states are realizing more and more the importance of workforce and the healthcare workforce being reskilled, being upskilled. And we have been working with a number of member states on notably the digitalization of the healthcare workforce. This is an area where we are certainly going to try to do even more. And one of the advantages of our way of working, which is a very collaborative approach with the member states, is that we can facilitate member states working together in a multi-country or multi-regional approach. That is extremely productive. We also have the possibility to facilitate short-term exchanges among civil servants from the member states. We have established a program named PACE for Public Administration Cooperation Exchange. And this is taking off with great success. And I really believe that multiplying these types of exchanges will allow us to have more cooperation, more coordination, and work towards more interoperability and capacities of communicating through integrated technology. So that's one aspect. I also wanted to come back, if I may, to two other questions. The question on climate, and I really like linking different topics, because who would be initially thinking of linking the issue of the green transition with the issue of healthcare and health union? Well, I'm delighted to let you know that we're actually working on this in the context of our ongoing project and almost closing project of a health hub. Together with the Austrian government, we're working on a project on the greening of the hospitals. And this is a project of which we are going to try and take lessons to possibly share with the other member states. So we're really trying to take into account there, it's one example of one project, but we're always trying to take lessons from the project that we drive in the member states to conceive further projects to offer to other member states afterwards. So that's one angle, and I'm certain, notably when we will be in a position to really establish this health hub, that not only are we going to facilitate better access to programs in health, better health spending, but better health spending means better health spending that is done according to green standards and taking into account green budgeting and green tagging, etc. The third point on which I wanted to react was the question of gender, which is very interesting because we're actually preparing a Gender in Public Finance Academy, and I was looking if I could find some more information on the program.
Is that brand new? Are you just making an announcement just now? That's really good.
This is completely new. This is something that would start being implemented in 2025. So we're presenting our ideas to the member state on the basis of some work that we have done in the past, notably on taking into account gender in public budgeting, gender in policy mainstream, and there we would really like to develop this academy. So we have already contacted some potential partners, and do not hesitate to relay this when your contacts with the member states, because they may be interested to join this. We believe that this is a top priority to include gender considerations in public finance more generally, and in public policies more generally, and of course in health. But to talk about health and health experimentations, I think I should leave the floor rather to more.
That's really good news, and you should get together. You've got a potential. All of you, the NGO sector, are committed to this. Get in touch with Natalie, because that's a great idea. Because we've been promoting gender proofing and budgeting for a very long time, and I know that it's absolutely key. But we've seen only small movements, and it's good that you're escalating that. Monica, before I turn to our final speakers, react to what you've heard so far, but on the issue of gender, how is gender innovation featuring and factoring in what you're doing?
Yeah, I think you've both articulated it extremely well, and this is a broader topic of diversity than just gender. We know that ethnic minorities are diagnosed later, cancer rates, treatments are not as highly accessed. So this is an end-to-end problem that we need to partner to support. So we've got a lovely programme actually in the UK that's partnering with ethnic minorities on making sure that access to cancer diagnosis are speedier. We also now have more engagement around understanding what are endpoints advancing clinical studies that are relevant for different patient groups. And as you alluded to, very baseline, we need to make sure that we have diverse representation in our clinical studies, because that is foundational. And maybe links onto another point when we talk about collaboration, and I think Jacob articulated it well around data, that this is probably, as well as scientific innovation, we now have an extremely powerful opportunity moving forward around how we analyze the data sets that we have. There's an extraordinary amount of data out there. And for the first time, we have AI tools that will allow us to analyze this faster than ever before. And we've been talking around personalized health for well, as long as I can remember, which is quite a long time now. And I think this now feels like this could be a real opportunity. But again, we read really pragmatic solutions on how we can share data, which can be a very tricky space once you get involved on it. So the more pragmatic and practical we can be when we talk about the European data health space, I think this is a real opportunity for healthcare for all of us.
Okay, thank you. Thank you very much. Right, over to our last two contributors. Thank you for being patient, both of you, Tomislav and Vlad. So Tomislav, will come to you first. Yeah, welcome back, because you were here last year. You've been a guest of ours on a number of occasions, and you've been always fairly outspoken and clear about what you think should be happening. So I want you to equally do that in the context of, as you look ahead to the next mandate, as we look ahead to what's going to happen in the next 4 to 5 years, what do you think we need to get right if we're going to get some of the discussion that we've just heard just now about how do we make sure innovation stays the course as we move ahead, but also your reflections on what you've heard from the EBSCO as well would be helpful.
Yeah, thank you for giving me the word. So, I mean, a lot of things have been mentioned here, really. So I don't know from which part to start, but I think when you speak about innovation, the first thing is to finish what we started. So we did the first reading of the pharmaceutical legislation. Now we are waiting for all of the institutions to become functional again, which will probably take at least 4 to 5 months. So we'll lose, unfortunately, a lot of time. But then we'll start the negotiations. And I think here we can really show what I think should be the main priority, that we need to determine what our priorities are, which industrial areas should be priorities of the EU. Pharmaceutical is definitely one of them. But if that is the case, and if we have to compete in the global market, where we are losing against China, US, etc., then we need to really look at industry as partners. So not as some kind of a boogeyman that some people in the European Parliament see that in that way, but we really have to see the industry as partners. So we cannot do it without the industry. I come from a former communist country. We tried to do everything by the state, but it didn't succeed. So definitely we need the private sector. Concretely on the pharmaceutical package, I think what is important is predictability. So if you want companies to invest, if you want companies to take on risks of developing new molecules, new medicines, and maybe 9 out of 10 will not get commercialized in the end, we need to create a legal framework which is predictable, which is stable. And definitely, I don't think that reducing incentives is the way to go. I think that the baseline should be in general kept as it is, but then to really focus and provide additional incentives in those areas where needs are the biggest. For instance, rare diseases, for instance, brain health that was mentioned so far. I see some experts in brain health here. So definitely retain the baseline to have predictability, but then to streamline and focus incentives to have investments in those areas where needs are the biggest. So I think that should be kind of the idea of the pharmaceutical package, of course, with all the measures that are already there to stimulate affordability and access. But we also need to be aware of the fact that this legislation is not a silver bullet which can resolve all the issues of access to healthcare, because the biggest competences here, biggest responsibilities on the member states. So pricing, reimbursement, procedures, etc. So here definitely EU should work together with the member states, but this legislation is not the legislation which can solve all of these problems. So there is also the Transparency Directive, Cross-Border Healthcare Directive, so still a lot way to go. The other thing that I would like to also mention is the implementation of the health data space, which was also mentioned here. These were very tough negotiations. I'm glad that we were able to do it at the very last second, I would say, of the mandate, because if we hadn't done this, we would lose at least an additional year before it gets implemented. So now we've been able to achieve this before the elections, and now we really have the possibility to use all of this data, which is now not utilized across Europe, to really facilitate research, innovation, and development of new medicines. Here, what was crucial was to on one side, give the patients the control over their data, the possibility to choose what will happen with their data, but in the end we get data data sets which are unbiased and representative. And I think that the final compromise, where the opt-out is the basis, not the opt-in, is definitely the right way to go, because we have studies which show us that if we go for an opt-in, we will get much more biased data, much less representative data, and in the context of what was also mentioned in terms of the gender issue, etc., I think this is also very important. So implementing now the EHDS, finding the budget to implement it, is also very important. In more general terms, I think what is important is that we keep the momentum on health. We already started to lose it. Unfortunately, we saw that to be very concrete when we lost 1 billion euros from EU for Health program for broader political reasons, I would say. So definitely fighting to keep healthcare as one of the priorities of the EU will be crucial in this mandate. And I think one of the most important arguments that we have, which is already mentioned here, is that we should look at healthcare not as a cost, but as an investment. Yeah. So this shift in paradigm is, I think, of crucial importance. To be concrete, in the European Parliament, I think the most important thing will be to get the fully fledged, separate healthcare committee. Because
I was just about to ask you that. What's this potential of that? Because that's where you could hub power to a certain extent.
Yeah, we have the subcommittee on health now, but it doesn't have legislative powers. No. Some political groups and some influential members from ENVI committee fought very hard against that because they didn't want to lose their power. But I think that these political groups are not in a position, as strong position as they were before the elections. And I can say that my political group, which is the biggest, the EPP, will definitely fight for this and will put this on the agenda, that we have a really fully fledged healthcare committee. Because, of course, the horizontal approach is important, but if you don't have concrete, strong institutions on healthcare, then we will not be able to put focus in different areas of health. I mean, just look at environment as an example. So environment became a priority. It got executive vice president of the commission who was focused on environment. We have the ENVI committee, which was 90% focused on environment in the parliament. And then with such a strong political background, such a strong political framework, we were able to have this environment in all policies approach. So first we need strong political will, strong framework, strong strong institutions on health if we want to spread and really have healthcare in all policies that we want.
Is that what you're going to say? You know, we're in a public forum. Are you going to work for a health committee to be established?
Yes, I've been saying this all along. There's I'm very direct on this issue. Good. I mean, we have also some more general issue about the fact that...
No, Tomislav, you're absolutely right, because the ridiculous nature of what we find ourselves in today is having to argue that health is an investment in our economy and our future well-being. Given what each of these politicians have experienced through COVID, you think, really? It's a
But look at European semester, for instance. So European semester started as focused on austerity, cut costs, cut spending, balance the budgets, etc. But now things have really changed. So now if you look at country-specific recommendations, we actually see healthcare as an end in itself already. So we really see a shift there. But unfortunately, there are still some colleagues, some from my political group, who say we don't want this to become a Christmas tree, etc., etc. It's like a list of good wishes, etc. Which in general I agree with. But as I said, if you change this perspective that healthcare is only a cost and see how much it contributes to the as an industry, as a very high added value industry, one of the biggest industries with biggest added value that there is, how much it contributes to our competitiveness, how much it contributes to the working environment, to possibility to prolong working years, to be more efficient, more productive in the industry, in the economy, etc. I think definitely we have all the arguments and we have data which show how that healthcare is an investment and that really economy in general can benefit from it. But just one last point, I think EU has another broader problem that we need a concrete common European industrial policy in general.
Absolutely.
And this because, for instance, if we have very strict state aid rules, if we don't allow our member states and European Union to provide incentives, concrete financial incentives in those areas where needs are the biggest, where we have to compete against the others, and the others do give subsidies to their strategic industries, then we are kind of fighting with both hands tied behind our back. So I think that in general, of course, not in all areas of industry, but I think in some strategic areas, we really have to think about broader range of issues, broader range of incentives. We should also include at least partially public funding as well, at least for some parts of the, for instance, of research innovation process, etc.
Let's hope that you become the new health czar of the EU. Because, what we do need, you need a compelling narrative that's not bullshit, excuse my language. You need something that has the economic weight behind it and understanding that you need to take industry with you. And at the moment, we don't have very much of a vision of an industrial strategy in Europe. It actually can't even, it's not even the making, because it seems like last century rather than future focus. One of the things I'm going to just shamelessly plug is, and I hope you take this on board if you do get your health committee. So these are our 10 policy choices for the new mandate. We worked with about over 250 people across Europe and the world to think about what should the mandate do next time round. There's 10 policy choices here. One of them is to enable the private sector to be a shareholder in a good society. And what we mean by that is that actually we've got to a point where even BMS or others will think about, every chief executive of a private sector company I've spoken to says we are treated as a profit maker rather than an enabler of a good society. And it's not about the corporate social responsibility agenda at all. It is actually saying if you had BMS or others at the table with you at the health committee, you'd get so much more intelligence, literacy of the industrial supply chains, not literacy, but literacy of the supply chains, and what you need to make sure everything can hang together. And I do hope that you're able to bring the private sector earlier on in the discussions. And I can see, I'm not going to bring you on this matter, because I'm not, but good. So but I hope you do that. I'm running out of time. Vlad, it's lovely to see you. And congratulations, you're an MEP now. You've been the man's been a Minister of Health, in Romania, obviously, already, but he's part of the new batch that's been brought in, so it's really good. And he's also one of our European young leaders. It's great to see you in this new role.
The first thing you should have mentioned.
I know, absolutely. But I don't want to brand ourselves too much. That's just far too shallow. You're a new MEP. And we've just heard about the importance of a health committee. Will you join forces with Tomislav to create a health committee? But also, what kind of thing will you do on the innovation side? Because one thing that none of us have answered, actually, on the panel, is a very serious question ever asked about infectious diseases. There's a crisis in the making in terms of AMR. We know right now, and we're seeing people being so, I suppose, dreadfully treated, being wrongly diagnosed, and actually being given more antibiotics, which don't actually work. So, threefold. Will you pump for a health committee? What are you going to do about innovation as a MEP in the new parliament? But then finally, we've got a crisis in the making. What kind of role will you play in making sure that is sorted, or at least put the infrastructure in place for making it sorted?
Which crisis do you mean now?
About AMR, that one. Because, it's very real. People may be on the surface, but the cost of it and the death toll, both at the aging side, but the fact that when in a context of, you could save so much money if you got the technology and the approach right to AMR.
Thank you for being fair, for having me here. Glad to be a new colleague of Tomislav and to work with the Commission. I was 2 times a health minister in Romania, and I'm one of the beneficiaries of the instrument, the technical support instrument. It worked fine. I would have some remarks before answering your questions, and I would answer them straight away. In my experience, the lead was always with the member state. And I'm listening to your questions and to what has been discussed. I was just wondering whether the energy, the power can always come from the member states, or some of the issues should be rather approached. For some of the issues, we should rather have a central approach, with the Commission being in a much more powerful role. Now, one example would be the climate issue. As a health minister, I would have loved to be able to even discuss about putting these topics together. But I had like 30 other issues that were pressing, as in hospitals burning during COVID, because of all the infrastructure, such as statistics being totally wrong, such as essential medicines missing. And I have a list here of frisium, bleomycin, cisplatin. Some might ring a bell for the doctors here, but not only. These are essential medicines that are currently missing from some countries in Eastern Europe, Romania for sure. And then are the other issues that are pressing, where the approach, I think, can only be an European one, like the healthcare workforce. I don't think that any particular country can really solve that problem by itself. I know for a fact, I'll just give you 2 or 3 data. In Romania, by the end of this European Parliament mandates, half of the GPs will be 60 years old. Half of them. Yeah. And that goes for Romania, that goes for Bulgaria, that goes for Poland. I think that is valid for Italy as well. Half of the Romanian doctors have left the country. From 2009, not over the last 2 centuries, but from 2009 to 2015, 6 years, half of them. So 1 in 2, because of lack of investments in the healthcare infrastructure, because of lack of investments in healthcare in general, because of political turmoil and so on. And these are, but then again, looking to Western Europe, I was talking to the medical director of Gustave Roussy in Paris, which is like the center for childhood cancer. They don't use all their beds in the hospital, so they have the infrastructure, they have the people, they have the procedures. They have the doctors, they don't have the nurses. They don't have the nurses. That goes for Istituto dei Tumori in Milan, in Italy, which is like the place, the go-to place for cancer in Italy. So they are not using. They have some of the resources needed. They don't have nurses. This is that bad, and it's a common approach that we need in that particular sector. I will come back to your question. So I am part of that political group that apparently opposed having the healthcare commission as a separate commission, as a separate committee. I totally agree with Tomislav. I will fully support that, and I already made sure that my delegation, the entire delegation from Romania, is doing that with the Renew group. So it totally makes sense. And if we don't do that now, after all that we have experienced in COVID times, I think I think this is a right moment to do it. Also within the Commission, I'm looking forward to seeing who the Commissioner for Health will be and what role he will have in the Commission. I think that's key. What will I do for innovation? I think innovation is one of the problems that we have in healthcare, and it's also, the opportunities, let's put it like that. And it's also one of the opportunities in economical terms is that we have for Europe's competitiveness. I just think the open dialogue, and I think we have something to work on. I think the new legislation on pharmaceuticals and the European health data space, I think these are good. This is a good ground to build on. I'm looking forward to see the components of the new commission and the new commission for healthcare, and I think I think it's an open conversation for all of those issues that have been mentioned here, and I'm looking forward to it.
Okay,
so
all right.
I'll just.
That's okay. No. But you have been through, when you explained, the kind of you create the reality check of what happened during COVID. And I'm not sure that we've fully learnt the lessons or continuing to do the right things. It's kind of there's great, what Natalie's saying is absolutely great. So on the one hand, you have this kind of bolder ambition, but the reality is on a member state level, it is so variable. And that's just the reality of the situation. I'm going to make sure, because there's so many hands up. And if those of you still want to speak, so can I get someone with the mic straight down here in the middle, please? Great. So, gentlemen here, are you still wanting to? You don't have to. I'm not. You don't have to. But go for it. Introduce yourself, please.
Hello, my name is Mihai Todirica. I'm a member of National Administration Association, Romania, Slătiol. European Union has a common agriculture policy. Do you think we should have a common health policy? This is my question.
Okay. Gentleman there, his hand up.
Thank you. Pablo Sagredo from UNEP, the United Nations Environment Program. And I want to pick actually the question that you had asked, Vlad, on AMR and kind of how you see the development of this crisis and what role the EU is to play there. I'm especially worried about the environmental determinants of AMR and how the EU is addressing that and the main drivers of AMR in the environment, which UNEP has identified as the pharma industry, as the food systems and agriculture sector, and of course also as the healthcare sector. So how is the EU planning to address that? So that's kind of a broad question there. And I also wanted to, I would have liked to hear a little bit more about prevention and the cost effectiveness of prevention. I think that's still a question that we have to talk about a little bit more. And of course, innovation and competitiveness is more than needed. But yeah, how is the EU addressing this issue as well? And how are we pushing for prevention at source and upstream prevention?
Great, thank you very much. I'm going to kind of leave that as a last question for all of you. So first you start, Natalie, on the kind of question, the issue of AMR. And, in terms of when you look at a dashboard of ill health conditions and their rise, we know AMR is significant, and we need to do something about. Is that going to be a priority that you're featuring in your work on reform?
Thank you very much. It's a great issue, of course. I mean, in the sense that we're very much thinking of working on it. But everything we do depends, of course, on the member states coming to us to work on it. So there, we may be thinking of building a flagship for the following year. But for the moment, we are very, very responsive. And we also try to help the member states, for example, to build multi-country projects. So because we have challenges which are being met by several, if not actually all the member states in the area of health, we really believe that it's very positive to work together and to try and establish and build and develop and share good and best practices on topics like this one.
Will prevention become the mantra for you as you move ahead? Do you think you'll have the wherewithal to be able to say, politicians, prevention matters?
Doesn't it?
Okay, brilliantly said. I won't test you further because I know you are a civil servant, so I won't put you in a tough spot. So I'm going to work through backwards. So Tomislav, you give us a sense on
AMR. I want to say, because it's part of the pharmaceutical package.
Yes.
Maybe that was the most contentious part of the negotiations. So how we stimulate creation of new antibiotics? Because one of the problems is that we currently have market failure, so it's really not profitable to develop new antimicrobials, and without new antimicrobials, it's impossible to tackle AMR, right? So that was one of the most, I would say, the most contentious issue in the negotiations. And now the Parliament's first reading kind of has a mix of push and pull incentives. So we kept the voucher, but with the stricter conditions, which was proposed by the Commission. So the voucher which should stimulate companies to develop new antibiotics, but we are combining this with a system of joint public procurement and milestone payments, which means that after you achieve a certain milestone in developing new antibiotic, you get a certain payment from the public budgets. We still don't have funding for that. But this is definitely, I think, a good approach, and one of the things that we should fight for in the next mandate is definitely a stronger budget for the EU in general, especially for the EHDS, but also for these kinds of incentives. So I think that AMR in the pharmaceutical package is one of the biggest priorities and should remain so, but we should really try to focus on finding solutions, finding compromises, not to be too ideological about this, because we have some really strong battles in the parliament on this. And the second point on workforce, I think that that's probably the biggest problem on the member state level. I come from also an eastern country, from Croatia. We also had big outflow of medical professionals, and the EU can really do a lot to help that, to tackle this problem in terms of providing new investments into infrastructure, into equipment, into better working conditions, into new specializations. So, for instance, in my country, we are funding the biggest part of new specializations from the European Social Fund. So definitely EU can really do a lot, but I think we should have a more strategic, systematic approach on what to do this, because it's not just, for instance, medical doctors. I think in my country, nurses are the bigger problem. Because we have really lack of nurses. I think it's a problem across the EU. So I think we should also have a common European strategy to be more systematic in terms of how to tackle this, but strong investments both into specialization, into training, but also in providing better working conditions is definitely needed. And I think EU can really do a lot there.
Thank you very much. I've run out of time, but Jakub, I want to turn to you, and I'll come to in terms of 60 seconds or so. Your view on prevention and a common health policy for Europe.
So I will start with the common health policy. Definitely, we can see the number of steps the Commission took in the past leads us, to this goal. If you take, for example, the European Beating Cancer Plan, definitely the good step. We can see there is a big request coming from rare disease area, from cardiovascular area, from number of therapeutic fields. We should have some joint approach, towards those therapies. At the same time, and I really appreciated what mentioned Tomislav, but also Monica. But at the same time, in number of European countries, we have no access to more advanced insulins. We have a very limited access to oncology treatment. So yes, definitely. I mean, there is a goal to have a joint European policy, on the healthcare, but we are still far away, from to have an equal access of patients around the Europe, and to have the joint policy, we have to move, with the access of patients to treatment to, let's say, more balanced level, and then we can move it, towards the joint policy. So there's still a lot of things to do it, and yes, the pharma package is only the part, but definitely we have to first, talk about the speed of access, but at the same time, how to manage, that these innovations or those innovations who came to the system will reach the patient. And in a number of fields, a number of countries, we will have an issue to deliver that treatment to patients.
Absolutely. It feels that it's definitely a case that when you think of listening to both you and Tomislav and also Vlad, that there really isn't a single market on health access in Europe. And actually, parts of Europe suffer desperately with the lack of infrastructure and the lack of basics. That's for sure. I'm going to end with you, Monica, but come back to you, Vlad. Any response you want to make on the issue of prevention and a common health policy?
Yes, also on AMR. So awareness for prevention and AMR awareness is key, and then education for doctors. So one of the measures that I took as a health minister is make sure that antibiotics are only prescribed with. Certain antibiotics are only prescribed with the consent of an infectionist, which was not the case in everywhere around Romania. And then the other thing is Romanians and Greeks and some other countries in Eastern Europe are the biggest consumers of antibiotica. So it's also an education towards the people who, and this is something where I think we might look at the European strategy or various instruments that can help towards that. Prevention then also goes to an AMR. I take them as well. Goes also cross industry to agriculture. and the veterinary use of antibiotics. I think this is also a key issue. Back in 2016 in the United States, for the approach towards AMR was with three ministries. It was the Ministry of Defense, it was the Ministry of Agriculture, and the Ministry of Health. So it's an interministerial committee who would approach that. I think this makes a lot of sense. Prevention, I think it's key. I think Europe is in a better situation than the US, for example, in terms of the quality of food, the quality of life generally. So I think this is one of our core values, I think, and this is also one of the things that are especially important for people, and one of the issues, one of the factors that would keep people in Europe in the next decades.
Okay, thank you, Monica. 60 seconds. You're all about prevention, aren't you?
I'm just going to answer a completely different question, actually. So, first of all, I just want to say that I'm really heartened by some of the comments that I've heard today around the collaboration. I think that's absolutely vital. And I do recognise Jacob's point around that access is at an individual state level. And if you look at the recent patient weight report, it's clear that there is an enormous disparity across markets in terms of both the number and the time to access. And, it might not surprise you that Germany is at the positive end, but actually if you have a look at some of the other markets, it may surprise you where some of them stand based on their GDP and the choices that they've made. But at the foundation, maybe I'll leave with a message of hope, because I was saying to Vlad, I'm an optimist at heart, and I think we have some great raw ingredients. We have fantastic science that is coming through. Technology is better than ever at allowing us to make use of that science. And if we have a collective willingness to find solutions to healthcare and to have Europe put this as a priority, I really believe that we can look to find those solutions together.
Thank you. Thank you all very much. We were going to have a video from the Minister, because you know that I've not brought Connie in, but we've got a video of making a kind of a contribution, which will play now. But, what I'm very kind of pleased that you've been able to stay the distance in the course. Thank you all for being with us. And thank you very much. Thank you.